OldGuyTalks.com is all about being a better man. Join me on this kick-ass journey. Exclusive stuff for members only in the Old Guy Cave. Opt in now. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You may have different results. This is Oris, the old guy from www.oldguytalks.com, coming at you tonight with Dr. Javier Cardenas. But before I do that, I need to keep Sue, the IP lawyer, happy with my disclaimer. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. You may have different results. Folks, if you know Sue, this is not the way she would have written it, but she said this works fine the way I wrote it. So let me talk to you a little bit about Dr. Cardenas. He is the director of Barrow Concussion and Brain Injury Center, an interdisciplinary clinic that is nationally recognized. He is also the director of Barrow Concussion Network, the most comprehensive statewide concussion education, prevention, and treatment program in the U.S., and we're going to talk about that later on in this interview. He also provides sideline concussion coverage for Arizona State University and the NFL, and he was at the Super Bowl. And you're on the NFL Head, Neck, and Spine Committee. If I remember correctly, you're currently the head of that committee. Is that correct?
I'm not the head of the committee, but I am on the committee, and I serve as a voting member.
All right. And he's also awarded the Arizona State Young Alumni Award in 2014 and the 2015 American Academy of Neurology Advocate of the Year. So just a little background here. I had I'm not going to call it the pleasure, but it was actually the fortunate circumstance where I got to meet Dr. Cardenas when my daughter had a concussion injury. Playing basketball. She played basketball throughout grade school and through high school. She's now at Barrett's Honor College and doing very, very well. But we've had with the two kids playing sports, the first one playing lacrosse and the other one playing basketball. We were no strangers to concussions, or what I call minor concussions. I don't know if that's what the good doctor here would call them. They were minor concussions, a little sensitivity to light, headaches, things like that. But when my daughter came home, this was very different. This was very different in terms of she had a very glazed look on her face. She had slurred speech. And quite frankly, when she first took the cognitive assessment, this is a girl who's a straight A student at a very, very competitive school, 90th percentile in all her tests and everything else. She scored in the 4th percentile of kids that had been tested, and quite, first of all, it scared the shit out of me too. It was all I could do to keep from crying at that moment. I knew I couldn't because I just need to. We need to get through this together as a family and to support her through this process. And Dr. Cardenas was absolutely wonderful in the whole process. Just as that background, I want to talk a little bit about what happens in the brain when somebody has a concussion.
All right, so a concussion is a mild traumatic brain injury. So we consider traumatic brain injuries mild, moderate, or severe. A severe would be like getting shot in the head. Moderate would be obviously somewhere in between where you might have damage to the brain tissue, bleeding in the brain, that kind of thing. But in a mild traumatic brain injury, a concussion, what happens is that the brain moves within the skull. And when it moves within the skull, it has a disruption in the function of the brain. So the way that I like to explain it, it's not unlike that of an earthquake. So anybody who's experienced an earthquake can see the damage it can cause in terms of buildings being destroyed, streets being destroyed, bridges falling down, all those kinds of things. That's like a severe traumatic brain injury. But then there are those little earthquakes, if you will, in which your books come off the shelves, it makes huge messes, but it actually doesn't cause any structural damage. And that's kind of like a concussion. So what happens is all these things within the brain, within the neurons, get spilled in the space between the synapses and in the space around the cells, and they have to be cleaned up. And it's during that time of cleanup when the brain is not functioning at its best. And that's when we see all the symptoms of concussion, whether they're headaches or thinking problems or mood changes. All those things are really a consequences of that trauma that's occurred to the brain.
Okay. So what's we talked about the grading here. What's the difference between concussion and a contusion?
Well, contusion by definition is damage to the tissue, is a bleeding of the brain, is an actual bruise to the brain tissue that can cause swelling, bleeding, and that actually indicates a more significant brain injury.
Mm-hmm. Okay. And I assume that there's different kinds of typically, what kind of recovery times are people looking at in concussions versus contusions, and obviously when you have a gunshot wound, well, it's all bets are off on recovery time, things like that.
Absolutely. So when it comes to recoveries at all, 95 to 98% of people who suffer a concussion have a 100% recovery. Mm-hmm. Those who suffer a moderate traumatic brain injury, which many times includes a contusion to the brain, about 40% of them have a full recovery, which means 60% don't. For those who have severe traumatic brain injury, none of them have a full recovery. Now, it doesn't mean that they're disabled in a legal sense, but it does mean that they have a permanent residual problem as a result of that traumatic brain injury.
Okay, all right. When you order CT scans and MRIs on these kind of patients, what information are you looking at to gather from those things?
Yeah, so one of the things that we're looking at, so the reason why we would do something like that is when something is out of the ordinary for recovery. So you asked earlier about the recovery time. So in a mild traumatic brain injury, in a concussion, the average recovery time for an adolescent is about 14 to 21 days. So we would order an MRI in somebody who's having a longer recovery, in somebody who has an atypical recovery, maybe they're getting worse. Somebody who has something on their exam that's abnormal, like weakness of one side of the body or abnormal, a lack of smell, those kinds of things. And what we're looking for when we order an MRI is we're looking for something that's worse than a concussion. We're looking to see, is there any damage to the brain tissue which would explain why they're still having problems, why they're having worsening problems, or why they have this abnormal finding on their exam.
Okay. You kind of touched on it. Tell us a little bit when the patient comes in to see you. What is it about your clinical exam? What do you do to assess that patient?
Well, the first thing, and this is true of all medicine, is a history, a detailed history, because part of what we're getting at is we're trying to find out, are they having a normal recovery from their injury? So the first thing we ask is, what's going on now? Are they having headaches? Are they having dizziness? Are they having sleeping problems? What are the emotional changes they're experiencing? What are the cognitive changes, thinking problems, trouble with school, etc.? And then I want to know, okay, now let's go to the history of the injury. And one thing that I ask of all patients is, tell me exactly what you remember happening, not what you were told, not what's in the EMS report, not what the police officers may have seen when they approached you, but really what you remember. And what you'll find is that for the vast majority of people, there will be a gap in memory. The only person who can identify a loss of consciousness is a witness, but the person themselves will identify a gap in memory. So, for example, an athlete, I was running down the field. Next thing I know, people are standing over me, okay? And they may say, yeah, I was knocked out when they came up, or they may say, I was walking around, I don't remember any of it. But there's a gap in memory and a dysfunction of the brain. Then you ask them, okay, how did you feel at that time? I was confused, I was dizzy, I had headaches. And that is all consistent with a concussion, all consistent with a mild traumatic brain injury. And then we ask, okay, well, when did those symptoms begin? Well, if they began within 72 hours of the injury, that is consistent with a concussion. And then we're looking where they're at now versus where they were at the time of the injury, and are they improving? If indeed they're improving, then we can actually take a hands-off approach to their care, meaning they may not need imaging of their brain, they may not need any medicines for the symptoms that they're probably having, but they might need things like accommodations in school, accommodations at work, just things to help them adapt while they recover from the injury.
Mm-hmm. When you're talking about concussions and recovering from the injury, what treatment are there? Meds, rehab, adjunct therapies? What's in your arsenal to help people get through this concussion phase?
Absolutely. So we're pretty lucky, you know. And the nice thing is there's more and more literature to support the things that we've been doing since we started this program, and that is an active recovery model. So once we see that people are not recovering as they typically would from a concussion, then we can employ different ways to approach those things. And we break them up in the three categories: physical, behavioral, and cognitive. So on the physical side, there are some people that might require headache prevention medications. So these are medications they take on a daily basis to keep you from having headaches. So things like Tylenol, Motrin, Excedrin, Vicodin, Percocet, all those are for when you have a headache. They do not keep you from having the next headache. So we like to switch those out. Those other medications that I just mentioned are also not good long-term medications. And so that might be one medication that we would consider. The other thing is people respond pretty well to balance therapy. So we have physical vestibular therapists who will help people regain their balance, help people who, if they're suffering from vertigo. And then there are occupational therapists who do vision therapy, help people with the coordination of their eyes, accommodation, eye tracking movements, those kinds of things. Then there are behavioral interventions. And the behavioral interventions may include psychiatry and psychology. And we're lucky because we have a psychiatrist in our clinic who specializes in brain injury. And so she treats all the mood-related issues associated with brain injury. And then we have a group of psychologists in the Valley that we work with who also specialize in brain injury. And the last piece is a cognitive piece, and there are two approaches to this. One is a testing approach, and that's usually a neuropsychology evaluation and or a computerized cognitive test. But also there's speech cognitive therapy that can help people with their thinking processes, with their focus, with their memory.
Yeah, that's actually what that was one thing that Natasha did with one of the ladies in your clinic. So you mentioned that basically you expect almost everyone from a concussion to recover, and those with more serious and, let's say, significant brain injuries not to recover. When do you have an idea of how people are going to recover, or is it something that you kind of plays out over time?
Well, and this is actually something that we've gained early on. The way that we approach patients is we really try to get them as quickly as possible from the time of their injury, in part because we want to get a good sense of what risk factors they might have for prolonged recovery. So, for example, if you have a history of headaches or migraines, you're actually more likely to have worsening of your headaches and migraines, and you might need earlier medication treatment than others. If you have a history of anxiety or depression, also a risk factor for prolonged recovery. If you have a history of seizures or attention problems like ADHD, those are risk factors that we need to take into account for the recovery phase. And so providing this information, and sometimes, quite honestly, it's the peace of mind that, yeah, you've got a normal exam, everything that you've told me consistent with the injury, everything that you've told me consistent with a normal recovery. So that puts some people at ease. And so we may approach some of them, those people, earlier if they've got a risk factor in terms of how aggressive we are with the treatment. Others, we tell them these things, and we may take a hands-off approach until they start demonstrating a prolongation of their recovery, or until they wax and wane, or until they exhibit some abnormal factor that requires further treatment and or testing.
Okay. One of the things that I was surprised to learn about, and like to talk about, is gender differences in concussions and hormonal and menstrual factors and rates of occurrence in young athletes. Can you kind of delve into that?
Yeah, so there's no question that there's a higher risk of concussion in female sports compared to their male counterparts. So, for example, female soccer players have higher rates of concussion than their male soccer players. Female softball players have higher rates of concussion than male baseball players. And there are some factors associated with this. One has to do with neck strength. So just anatomically, females have weaker neck muscles than males. Mm-hmm. And we know that that can play a risk factor in actually the occurrence of concussion. The other is that when it comes to some of those risk factors that we mentioned earlier, migraines, anxiety, those kinds of things, they are more prevalent, especially in the adolescent female. Mm-hmm. And the last thing is, there are some studies that show that females, depending on the right circumstances and the right culture, are more likely to self-report and or report for their teammates concussions than their male counterparts.
Okay. Yeah, I was surprised, and then once you explain it, it makes sense about why there would be a different rate of concussions. Is there such a thing as just a headache, or is it all a concussion?
All really kind of has to do with the association of the injury. If you have a temporal onset of headache, so for example, there's a hit to the head and the headache starts within 72 hours of the injury, even if that's the only feature, then we're going to err on the side of caution and associate it with the concussion. Now, there can be some challenges. So, for example, people who have persistent headaches after a concussion, sometimes they have a history of their own migraines, in which case they've had worsening of those migraines. Other times they have a strong family history, and it may have been the precipitating factor that they were going to start having migraines. So, especially in the adolescent population, the number one presentation for migraine is in adolescent female. The number two is in adolescent male. So if their first experience with migraine is after a concussion, and then later on, whether it be weeks or months later, then they have recurrence of migraine, but they've got a strong family history, that actually might be more of a culprit than the concussion itself. Early on especially, though, we're going to take that association with the injury and we're going to treat it as a concussion, make sure that they recover from that injury at rest and with activity before we return them into a sports setting.
Okay. Now, is it still the recommendation that quiet and no noise and things like that is part of the recovery and for as far as the treatment and the recovery period?
Yes. However, part of it has to do with that time frame. So, for example, when you and I were in sports, we got the pat on the butt after a head injury and went right back out into our sport. We know that was wrong. And then we had this pendulum swing the other way. And in that pendulum swing, we told people to go into a cold, dark room and come out when they're better, meaning no screen time, no video games, no interactions, no physical activity, all those things. And what happened is that you actually saw prolonged recovery, in part because, especially athletes, they got depressed, they got anxious when they weren't allowed to engage in any physical activity. Mm-hmm. So the new consensus statement, which just came out of the Berlin 2016 summit and was published last April, recommends a brief period of rest. So anywhere between 48 and 72 hours, and then engaging in normal physical activity, social activity, etc., even screen time. But the biggest thing is that we avoid another head injury. That's the only thing that can cause damage to the brain tissue. Mm-hmm. Engaging in light physical activity is not going to damage the brain. Engaging in social activity and screen time, not going to damage the brain. Engaging in academic activity, also not going to damage the brain. And in fact, there was a paper that was published just recently out of JAMA looking at the evidence for prolonged recovery and not very much of it, and prolonged rest rather, and better evidence for early engagement in physical activity and other activities after concussion.
Okay. In my introduction, I spoke about having a comprehensive statewide concussion education, prevention, and treatment program. Tell us a little bit about the Barrow Brain Book and how that plays into it, and what was the program that makes it so special in terms of what's going on in Arizona.
Absolutely. So there are two sides to our program. One is the clinical program, which is a multidisciplinary program that includes neurology, neuropsychology, psychiatry, includes a complement of therapists, physical, occupational, and speech. And then there's our community program. The community program is really for our youth athletes. And that's where we offer Barrow Brain Book as our concussion education program. It was the first concussion education program to focus on the athlete themselves. There was education for coaches and for parents and for healthcare providers, but this was the first that targeted the high school athlete. Mm-hmm. Then there is impact testing, which we provide for free to all Arizona high school athletes for schools that have an athletic trainer. And then last is a telemedicine program in which athletic trainers throughout the state can consult us as concussion specialists at any time.
Okay. You mentioned the impact program. Is that where as student athletes are tested before beginning of a season or a sport to get a baseline value?
Right. So it's specifically baseline cognitive testing.
Right.
So when we talk about baseline concussion testing can mean anything. It can be baseline balance, can be baseline cognition, can be baseline eye movements. But in this case, we're talking about computerized cognitive testing. So you get a baseline, and then in the event of an injury, you can compare the individual athlete to themselves based on those values.
I know. Because some kids have issues with certain things that their baseline is actually way off from where they are. Especially if you have certain challenges like dyslexia and things like that, where you may not be able to say the numbers backwards anyway, even in your best day.
Well, and you bring up a good point. So in fact, baseline cognitive testing is more valuable in kids who have learning disabilities and kids who have ADHD and kids who have factors that might skew their performance. Mm-hmm. So for most kids that don't have those particular learning issues, you can get a post-injury test without a baseline and compare them to the general population. And that can still be helpful. But if you don't have a baseline, you have ADHD, a learning disability, etc., then it's harder to make that comparison.
Sure, yeah. What sports are more prone to athletes getting concussions than others?
So number one, at least if we're talking about high school sports, remains football. A distant second is soccer, girls soccer over boys soccer. And then you look at the other contact sports, basketball, baseball, etc. And then non-contact sports have the least risk for concussion. Mm-hmm.
Yeah, so yeah, the football is no surprising. So you are obviously very, very much involved at the NFL. What's different about is there anything different about an NFL player getting a concussion versus a high school football player or a college football player getting a concussion? What's the difference there, or is there any?
So from a medical standpoint, there is no difference. What I've seen from a practical standpoint is that the NFL players, when they see me in my red hat on the sidelines, they know what to expect, meaning they know the routine, they know what they're supposed to do. They know that, yes, okay, you've been identified as having a potential head injury and we need to evaluate you. Versus college, in which a lot of the athletes are still resistant to our interventions. They're still resistant. They're like, why are you taking a look at me? I'm fine, let me play, etc. So this is really the culture change that we've seen at this level.
Mm-hmm. And as a professional athlete, are they more accepting of you and your intervention? Is that what's happening, or?
Yeah, to be honest with you, when I first started this program and I saw it at all levels, I saw it at a professional level, I saw it at a college level, and I saw it at a high school level. It really befuddled me as to why the professional athlete was more likely to come off the sidelines, more likely to self-report, more likely to report a fellow teammate with a concussion than a college player or a high school player, where we still saw a lot of resistance to self-reporting.
Mm-hmm.
And especially with so much money at stake. But in fact, I think that also is the explanation, meaning that those professional athletes, that's their livelihood. If they're off, if they're having trouble because of a head injury, they're not thinking about just that game. They're thinking about the next game, and they're thinking about their career for the rest of their lives, because that's the way that they make their livelihood. Some of the college players, they are thinking, well, there's a scout out there. I'm going to be tainted goods. That might be an issue with them going to a professional program or being pulled out in something that they don't want to be pulled out, and then they're not able to perform like they want to.
Sure. So let's say you're at a game, your player or your child gets hit in the head. What should they do? What's the steps?
Sure. So the first is, when in doubt, sit them out. So, and the reason why we say that is because that's really the best advice. Is they get hit in the head and you're not sure, did they have a concussion? Well, as a parent, you're not expected to make a medical diagnosis. If you have medical services on the sidelines, defer to the medical professionals. If you don't, just pull them out. It's not worth them suffering another head injury, having a prolonged recovery, or even worse, a bleed to their brain, etc. Mm-hmm. The other thing that you're going to want to look for as a parent, once the athlete has been pulled out, is you're going to want to look to see, do they exhibit any of the red flags? So some of the red flags would be a seizure. Another red flag would be a worsening headache. Another red flag would be they're having a depressed level of consciousness, meaning they're becoming less and less interactive and more sleepy as time has gone on. And for those red flags, you're going to want to go to the emergency department. If those red flags are not present, then watch them, obviously, and you still want them to see a healthcare professional as soon as possible, but it may not need to be at that moment.
Mm-hmm. Okay. All right. Well, Dr. Cardenas, I want to thank you. But before we get done with our interview, as you may be aware, the old guy is about virtues and vices. Mm-hmm. And so he always likes to ask his guests about their vices. So some of these are vices, some of these are not. So if you were to compete in an Olympic event, summer or winter, what would it be?
If I were to compete in an Olympic event, summer or winter, I would probably it would be a summer event, and the reason is I'm not a fan of the cold, and it would probably be track and field. So I like track. I like to run short distances, and that's probably what it would be.
Okay. And what kind of music do you like to listen to?
I like all kinds, but if I had to pick one band or one type, it'd probably be I can't go wrong with Led Zeppelin.
Oh my gosh, one of my favorites. That's right. Who could go wrong with Led Zeppelin?
Can't go wrong.
Wow.
Stuck on a desert island on your own, you can listen to Led Zeppelin all day and all night.
Led Zeppelin, AC/DC, Aerosmith, yep. They all work. They all work. So if you are eating something in the closet that you don't want anyone to see you eating, what is that thing?
It's probably going to be a brownie.
A brownie? Okay.
Yep.
And do you smoke cigars?
I do not.
Oh, okay. Let's try to get you on that. And your alcohol. Do you have an alcohol that you like?
I like wine. Just about any type of wine.
Okay.
Favorite is a Malbec.
Okay. And what would someone be surprised to find out about you? That would be like, oh my gosh, I can't believe he does that.
You know, I don't know what that would be. But one of the thing in my past career was I was a special education teacher before I went into medicine, which tends to be a surprise for some people.
Okay. All right. So how did you transition into medicine?
Actually, the student population that I was teaching, I had obviously brain disorders. I wanted to explore that more.
Okay. Well, wonderful. Wonderful. Well, I want to thank you for coming on the program and teaching us and telling us more about concussions and the protocols and giving us some distinctions about what to do and what not to do and what to expect if you ever happen to be in the unfortunate circumstance of having to deal with your own concussion or someone having a concussion in your family. If you are lucky enough to live in the Phoenix, Arizona area, then you are lucky enough to possibly go to Barrow's Neurological Institute and be treated by Dr. Cardenas in his clinic, which is absolutely they take a hard experience and make it into a very, very pleasant experience with both he and his staff do that. So, folks, that's all we got for tonight. This is Oris the Old Guy from www.oldguytalks.com. If you have not already opted in, do so now. And I will tell you 3 ways how to improve the quality of your relationships. And you know what I mean by quality of your relationships. When you opt in, 3 easy ways. They don't cost you any money. And remember, it's all about having a kick-ass life. Good night and talk to you later.
Thank you.
Opt in and encourage other old guy assholes like you to opt in also.